my name's Tasia Holmes, and I chose to look into ethical violations from my neighboring state of Maryland. I looked into 40 cases in Maryland, most of which of these cases contain multiple ethics violations, but most frequently the code of 10580304, which is a breach of ethical responsibility at 65% of the time, with a close second, which was the violation of the counseling relationship at 43%. So I looked at one particular case where the respondent in this case maintained a private practice in Maryland. In March 29, 2017, a patient alleged that this counselor, or the respondent, had been in a sexual relationship with him. That started 5 to 6 months into the counseling relationship and ended at the 3-year mark. The relationship ended because the respondent stated that the client became threatening and inappropriate, at which time she chose to destroy all records, although admitting to knowing that there was a 5-year retention period for keeping all records in Maryland. The Code of Maryland stated that she violated 10580303, professional compliance, 10580304, ethical responsibility, 10580309, sexual misconduct. Then January 26, 2020 of this year, she did surrender her license. The ACA codes I found that were violated in this case were A1B, records and documentation, A4A, avoiding harm, A5A, sexual or romantic relationships being prohibited, A10F, receiving gifts, A11A, compliance with termination and referral. And as I said, the outcome was that she did lose her license and will not be able to practice counseling ever again. So Section C talks about professional responsibility in the ACA Code of Ethics, and A2G talks about impairment, and that we must monitor ourselves as counselors, for physical, mental, or emotional problems. But at the end of this, it also states that other counselors can assist in this, supervisors, colleagues. I do consider that possibly in the case that I brought up that there was no one. If she was in private practice by herself, then maybe she had no one to help self-monitor her. So the Maryland Code of Ethics never quite addresses counselor impairment. However, 10580303 does talk about professional compliance, which reads very similar to the ACA code that I just discussed. So I'm curious about the cases that I went through, the 40 cases. A majority of them were in inpatient facilities, typically alcohol and drug abuse situations. And it made me wonder, with such a high volume of cases in an inpatient setting, what is going wrong? Is there too much work? Are there too many patients? That all these violations are occurring and ethics issues are occurring with clients or with counselors. So I did find a study, Moral Mindfulness, the Ethical Concerns of Healthcare Professionals Working in a Psychiatric Intensive Care Unit. The conclusion of this stated that the study has investigated the staff's ethical and moral concerns about their work as healthcare professionals in a psychiatric intensive care unit, and significant findings emerged from this study that are that the staff faced ethical concerns about how to deal with becoming unprofessional due to high expectations. Staff concerns are not necessarily focused on patient violence, but concerns, moral concerns entangled with worries about being unprofessional. So, trying to figure out how to deal and balance the load in that situation is possibly something to think about, and how to, help with the workload and the impairment issue and wellness with counselors in that situation. So thank you for listening, and I hope you all have a great day.